The patient and family teaching should include instructions for the patient to avoid driving or using heavy machinery while taking the drug because it may cause drowsiness. For the patient to contact the healthcare provider for recommendations about calcium and vitamin D because the drug may increase the risk of osteoporosis. For the patient not to use over-the-counter PPIs for longer than 2 weeks. If symptoms continue, they should contact their healthcare provider. If taking prescription PPIs, take the full prescription, even if their symptoms don't exist or if they feel better. These drugs do not cure ulcers, but they do reduce the acid in the stomach so that the ulcer can heal. Remind the patient to wear sunscreen and protective clothing because their skin will be more sensitive to sunlight while they're taking this medication. Cytoprotective drugs protect the lining of the stomach and help prevent further damage from stomach acid. When taken properly, some of these drugs can stick to the ulcerative areas in the stomach or duodenum to protect them from further damage and allow them to heal. Sucralfate aids in the healing of ulcers by forming a protective layer at the ulcer site, providing a barrier to injury caused by gastric acids. Misoprostol is a synthetic prostaglandin with both an anti-secretory and a mucosal protective action. Although it has other drug classifications, it is a cytoprotective drug for the GI tract. It is indicated for gastric distress or ulceration due to NSAID use. Examples of these drugs is sucralfate, known as Carafate, bismuth subsalicylate, known as Pepto-Bismol, misoprostol, known as Cytotec. The nursing implications are not to give antacids 30 minutes before or 1 hour after sucralfate because they decrease the drug's effectiveness. Do not crush or chew the tablets. The tablets are scored and they may be cut in half for easier swallowing. For patients who are unable to swallow the half or whole tablet, dissolve the tablet in 10 milliliters of water. This is referred to or called a slurry, and allow it to stand for about 10 to 20 minutes. To achieve a consistent dose of drug in a solution, shake the oral suspension well before giving it. Carefully review doses before bismuth subsalicylate before giving because this drug can be used for several conditions besides gastric distress. The treatment of diarrhea, the prevention of traveler's diarrhea as well. It can also be used for its antibiotic properties. If patients do not receive relief from the recommended doses, make sure to contact the patient's healthcare provider in case there is a significant underlying condition that needs treatment. Teach the patients that bismuth subsalicylate can turn stools dark brown or black while taking the drug. Taking too much bismuth subsalicylate can result in symptoms of aspirin toxicity because of the salicylate components of the drug. Encourage the patient to drink at least 2 to 3 liters of liquid daily unless this is contraindicated because this drug can cause constipation. And remember that misoprostol must never be given to pregnant women because it can cause uterine contractions, which causes miscarriages. Patients experience constipation for multiple reasons, such as a low-fiber diet, low levels of physical activity, ignoring the urge to have a bowel movement, pregnancy, and aging. Other causes include certain drugs, dehydration, certain bowel disorders, depression, and other medical problems. Most episodes of constipation are mild and do not require drugs or input from a healthcare provider. Some are relieved with the use of an over-the-counter laxative. However, if constipation becomes severe, the patient experiences bleeding or abdominal pain, or constipation lasts longer than a few weeks, the patient should contact his or her healthcare provider. Like constipation, diarrhea is a symptom of other health conditions. Diarrhea is caused by an increase in the amount of water in the stool. This increased water results from an imbalance between the amount of fluid secreted from the intestines and the amount of fluid absorbed back into the body. If the amount of fluid secreted is greater than the amount reabsorbed, water will remain in the colon, and the stool will be loose and watery. This may be a result of infection, drugs that change the bacteria in the colon, inflammatory bowel disorders, food poisoning, or other medical conditions. Laxatives are a class of drugs that promote bowel movements by stimulating peristalsis, increasing the bulk of the stool, or softening the stool. They are typically used to relieve constipation. Laxatives are also used to cleanse the bowel in preparation for surgery involving the GI tract. Certain X-ray studies and endoscopic procedures such as colonoscopy and proctoscopy. They can be used as part of bowel care for individuals who have lost neurogenic control of the bowel. Although laxatives can be very helpful for short-term treatment of constipation, they are not a substitute for a healthy diet, adequate hydration, and physical activity. There are 5 major categories based on the mechanism of action: bulk-forming drugs, stool softeners, lubricants, osmotic laxatives, also called saline laxatives, and stimulants, also called irritant laxatives. The increased bulk stimulates peristalsis, resulting in increased bowel mobility and more rapid transit time through the GI tract. Stools are easier to pass. These drugs also help patients with watery diarrhea by increasing the bulk and consistency of the stool. Bulk-forming laxatives relieve constipation by absorbing water in the GI tract, which alters intestinal fluid and electrolytes. Absorption of fluid expands the stool, increases the bulk. The increased bulk stimulates peristalsis, and the absorbed water softens the stool. Bulk-forming laxatives are used for treatment and prevention of constipation. They can also be used in the management of irritable bowel syndrome or diverticulosis. Laxative effects can occur as soon as 12 hours after the dose or as long as 3 days later. Examples of these drugs are methylcellulose, known as Citracel, and psyllium, known as Metamucil. The patients need to understand that these drugs can typically take about 12 hours to 3 days before they start working. The patients need to understand that they need to be consumed with a full glass of water with each dose to avoid bowel blockage. The drugs can be mixed with water, fruit juice, or milk. Stool softeners relieve constipation by reducing surface tension of the stool so that water and lipids can enter the stool and soften the feces, which makes it easier to pass the stool. These drugs are helpful after surgery for the patients who should avoid straining. Softening of the stool typically takes 1 to 3 days after starting this drug. An example of this drug is docosate, also known as Colace. The nursing implications in teaching the patient to understand that their urine is going to change colors resulting from consuming this medication. It will change to potentially a pinkish red to maybe even a yellow brown, depending on the alkalinity or acidity of their own urine. Potentially, the patient will experience in 1 to 3 days the benefit of taking this medication. This medication is not intended to treat acute episodes of constipation, but it is to help prevent constipation from reoccurring when taken on a day-to-day basis. When rapid relief of constipation is desired, stimulant, also known as an irritant laxative, may be used. They are often used to treat acute constipation resulting from prolonged bed rest or poor dietary habits and constipation induced by other drugs. They may be used in combination with osmotic laxatives as part of a bowel preparation for surgery. Stimulant laxatives increase peristalsis by several mechanisms depending on the agent. These drugs can stimulate sensitive nerve fibers in the intestine, irritate the mucosa in the intestine, and affect water and electrolyte secretion in the bowel. The result is increased peristalsis and stimulation of a bowel movement, usually within 6 to 8 hours. Some drugs may act more rapidly, so carefully read the drug information before giving stimulant laxatives. In the past, it was thought that stimulant laxatives could cause physical dependence on laxatives. Recent evidence suggests that it is not the case. Nevertheless, frequent use of stimulant laxatives should be avoided in favor of improving diet and physical activity. When long-term constipation relief is needed, bulk-forming laxatives are more likely to be recommended because of the low incidence of side effects. An example of this drug is Biscadol, known as Dulcolax. A nursing implication: these drugs are available over the counter and may be used for occasional constipation. Higher doses may be used as bowel preparation for x-rays, for the colon, or for colonoscopy. Inform the patient regarding the expected onset of action. Oral tablets can work within 6 to 12 hours. If given by rectal suppository, it can work as soon as 15 minutes or up to 1 hour. Lubricant laxatives relieve constipation by creating a barrier between the feces and the colon wall that prevents the colon from reabsorbing fecal fluid, softening the stool. The lubricant effect also eases the passage of feces through the intestine. Lubricant laxatives are used to soften stool in conditions in which straining should be avoided, such as myocardial infarction, aneurysm, stroke, hernia, and after abdominal or rectal surgery. They can help prevent pain and decrease the risk of tearing or laceration of hemorrhoids or anal fissures. An example of this drug is glycerin suppository, also known as Sani Sup.